Golf Central on YouTube, brought to you by the Chrome Soft Golf Ball from Callaway.
Hi again, everyone. I'm Jimmy Roberts, and this is your Golf Central update. A little more than a week after we last saw Tiger Woods withdraw from the Masters, the 15-time major champion announced that he has undergone yet another medical procedure. The tweet released earlier today. Woods saying that he had a subtalar fusion. That's a procedure on his ankle to relieve post-traumatic arthritis. The surgery was performed at the Hospital for Special Surgery in New York by Dr. Martin O'Malley. Surgery was deemed to be a success, and Woods is in the process of recuperating already. So this is something that we have heard before. Woods, no stranger to surgery and recovery. His back, his knee, now his ankle, to go along with that horrible accident and whatever procedures were necessary to correct the aftermath of that. With that, we welcome in NBC News medical fellow, Dr. Akshay Cyle, joining us from NBC headquarters in New York. Dr. Cyle, first of all, can you explain in layman's terms what a talus fracture is?
Hi, Jimmy. Good to be with you. So great news that Tiger's surgery went well. But put simply, he had a fracture of his bone in his foot that sort of connects it's at the bottom of the foot, but the joint that he had the procedure on today really connects the heel bone to the ankle bone. And put simply, the reason most people have this procedure is actually from arthritis. It's a pain relieving procedure. And it's relatively simple. It's a relatively simple procedure. It's a few hours long with a pretty straightforward recovery. But with the goal here really to prevent those two bones from rubbing together and causing that arthritis and fusing those bones together so those two bones become one and getting rid of the pain, hopefully for Tiger as well.
So this is not an uncommon procedure then?
No, it's not an uncommon procedure, and the most common, or one of the most common reasons to get it, is actually the reason that Tiger had, which is
Right.
arthritis from trauma. So a lot of people don't know this. If you have trauma to a joint, you're 7 times more likely to get arthritis in that joint, basically because of the mechanics get messed up, and you also get a lot of inflammatory markers in the area that can destroy the joint. So for that arthritis, you tend to have a very painful foot. It tends to hurt a lot when you walk, and I suspect that's what was happening with Tiger. So by fusing those two bones together, you prevent them from rubbing against each other. Hopefully that'll help Tiger get rid of some of the pain and get him back to competing soon.
All right, so let's just be very, very clear that you have no specific familiarity with Tiger's case, but we're talking in general terms here. So no timetable has been given for his return. But what do you think, in general terms, a recovery from something like this would entail in terms of a timetable?
So generally speaking, Jimmy, the timetable for return here is, well, first you have to have a cast or a boot after the procedure. It can last anywhere from 2 to 3 months, and after that you start to work through therapy. You start to build some of your strength back. And where I think this gets interesting is, the PGA Championship's coming up in a few weeks. The U.S. Open soon after that. So you were going to be following that timeline pretty closely, but I suspect for the PGA Championship, I believe in May, it's unlikely he'll be competing in that. The U.S. Open, still remains up in the air.
Well, the man obviously studied medicine, but he's a golf fan as well, knows the golf schedule. Let's talk about mobility and how this might alter his mobility.
So that's a big thing with this procedure. It's described to me as a trade-off by the orthopedic surgeons I talk to, in the sense that you have the pain and you're having the procedure to get rid of the pain, and the trade-off is you can have some decreased mobility. The good news is, for most daily activities, most day-to-day things, you should be okay. He is competing at the highest level, and when we talk about athletes who compete at the highest level, every little thing matters. So I don't have a crystal ball here, but it'd be interesting to see how his mobility plays out. But the good news is, for most people, this is a successful procedure. They do become pain-free, so it'll be interesting to see how that trade-off plays out in Tiger's case, Jimmy.
Dr. Cyle, let me just ask you a very, very general question here. I think we're talking now 10 surgeries as far as we can tell, on his back, on his knee, now his ankle. Are you surprised, generally, if somebody presented this to you and said, here's patient A, and he's had all these surgeries, that this is a professional athlete who could be effective?
No, and you're right. It's unusual. It's not something that we see in our patients every day. I think the biggest thing for him too in getting over all these procedures and having to do this every few months or years, it seems like, is his emotional state. I mean, is he okay having to go through the knife, having to go through the recovery? I mean, that's incredibly frustrating for normal people, let alone athletes who depend on their skill and their talent to make a living. So I think that's the thing that we really need to be paying attention to, is how much more of this is he going to take? Is he going to keep going under the knife over and over and over again? Or at some point, is he, he's going to step back a little bit, at least from having surgeries?
He has always been an incredible athlete, never ceased to amaze us. Dr. Akshay Cyle reporting to us, or joining us, I should say, from NBC News in New York. Dr. Cyle, thanks for joining us.
Thanks for having me.
Well, in addition to Dr. Cyle, we were joined by Todd Lewis earlier today, who spoke on the latest surgery Tiger underwent.
Well, I can tell you, just like his spine, his ankle is now fused. The reason the surgery was performed is to, as the tweet indicated, to help with the arthritic pain. Let's not forget that in that accident, his right ankle was essentially shattered. He has a lot of hardware in that ankle. And because the ankle has so many joints, there is arthritic pain associated with that type of injury. And his ankle has been the problem. He's told me, not to say that his leg has not been a problem as well, but his ankle has been the most serious problem. Now, what this is going to do is going to reduce the arthritic pain, this surgery and this procedure, but it's also going to limit some of his mobility in that right ankle. Now, when will we see Tiger? That's the big question. I talked to Henry Fleischman, who's a noted surgeon, and he told me that you can expect on the average 10 to 12 weeks of recovery from this procedure. So that means Tiger Woods that looks like he's not going to play the PGA Championship. He likely will not now play the U.S. Open. He could possibly, if his recovery is successful, possibly play the Open. Now, Dr. Fleischman also said that you will have the most positive full effects from this procedure a year after the surgery. So right now, Tiger Woods is hopefully going to be in less pain, but it's going to take him a while before he really sees the full extent of that.
Todd, he is 47 years old. He is so enormously popular every time he gets out there and gives it a go. And, we heard a number of people say, most specifically Rory McIlroy at the Masters, saying that he still can hit all the shots. It's the walking that's the hardest part for him.
Yeah, and he's right. And Rory's good friends with Tiger. It is the most difficult part for him. And if you look at his swing, it has changed quite a bit as well. He can't really push off that right leg. He's got more of a upper core swing, but he does have all the shots, and he's still, in my opinion, the best game manager ever in the game of golf. But again, these injuries continue to bother him, and the walking is a big problem for him, walking 72 holes, especially when you're at an environment like the Masters, which has so much elevation, and then you combine the rain and the heaviness of the golf course. So it's a really difficult challenge for Tiger when he gets into a golf course that's got a lot of hills, and weather is a problem.
Tiger Woods in the news again this week in golf. Of course, the LPGA has its first major of 2023 at the Chevron Championship. The PGA Tour will also be in Texas, the Invited Celebrity Classic at Los Colinas Country Club in Irving. PGA Tour playing its team event in New Orleans, and the DP World Tour returns from a brief hiatus at the ISPS Handa Championship in Japan.